The content of this podcast is for informational and entertainment purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your healthcare provider with any questions you may have regarding your mental or physical health. The views expressed are those of the host and guests and do not replace personalized care from a licensed professional.
Welcome to Mindful Moments with Pedro Morante, a space where a nurse practitioner and educator shares real talk on mental wellness, mindfulness, and navigating life in and out of healthcare. Let's take a moment to breathe, reflect, and grow together.
Hello everyone and welcome to Mindful Moments with Pedro Morante. Today's episode is the missing vital sign, connection, mental health, and loneliness crisis in healthcare. And I'm joined today by Dr. Chrystene Nguyen. And this another episode will explore the human side of healthcare and the conversations that matter most of the well-being of clinicians, patients, and communities. Today, we're tackling issues that affects countless healthcare professionals but most often remains invisible: loneliness. Healthcare providers spend their days caring for others, listening to patients, solving problems, and carrying the immense responsibility. Yet many quietly struggle with feelings of isolation, connection, and emotional exhaustion. What happens when the people who dedicate their lives to healing others begin to feel alone themselves? Join us today with Dr. Chrystene Nguyen, a family and lifestyle medicine physician, entrepreneur, and community builder. She is the founder of White Coat Romance and White Coat Mingle, trusted communities designed to help clinicians and healthcare professionals build meaningful personal, social, and professional connections. Today, we will explore why connection may be the missing vital sign in healthcare and how loneliness impacts mental health and what it can do to build a healthier and more connected communities within our profession. Dr. Nguyen, welcome to Mindful Moments with Pedro Morante. We met at the conference earlier this year, and I'm so glad that you're here right now in my platform.
Oh, well, thank you so much for inviting me here. And it was just so amazing to meet you at the conference earlier this year. And thank you for such an amazing introduction. It was very kind of you. I'm just so grateful that I got a chance to meet you and we got a chance to connect. And here we are having this opportunity to be able to have this very important discussion. So thank you so much for that. And I really just want to acknowledge all the amazing work that you're doing, Pedro. I mean, for creating this space. You're a psychiatric nurse practitioner, you're an educator, you're a leader. Oh my goodness, you've helped so many others in your path. And we all know these are the effects that gets amplified. And you build mindful moments. I'm just really amazed and impressed at the work that you're doing. And this is really just a wonderful space that I wish I'd known earlier. This is a place where clinicians can like pause and reflect and really talk honestly about what it takes to stay well while caring for others, which is something that's so important. And, nurses and nurse practitioners, you guys are like the backbone of our day-to-day care and the emotional climate of our healthcare system. So I can't thank you guys enough. And I greatly appreciate you inviting me here to be a guest. And I can't wait to talk more.
Thank you, Dr. Nguyen. And for those who may not know you yet, tell us a little bit about yourself and the work that you're doing right now.
Yeah, so we always start, for some reason it's like natural, even though we think about titles, as if it gives us like some sort of uh, basically like authority. But at the end of the day, we all know that that's not really what's truly important. But I will mention it just so you guys can get a sense of like my background. So I'm a family and lifestyle medicine physician, and I thought that that was just going to be like my identity, right? These labels that I gave myself, right? For the longest time, and it was interestingly enough, I mean, everyone's lives changed when COVID happened, and one of the silver linings that came out of COVID was what I built. Um, and it I work in urgent care, and so as we all can recall those days, and the high risk exposure, especially for someone like me working in urgent care, I was just feeling completely like isolated and alone, and I was purposely isolating myself from family and friends, and I knew I wasn't alone, and so I on a whim I started a Facebook community called White Coat Romance. It was just a really small space for like just a few health physicians and other healthcare professionals, just as a way for us to like provide support. I started planning some virtual events, and then after a while, when things started opening up, I started planning in-person events, and it was just amazing. I did it for me, and I did it for my friends, and then of course, it grew into our larger community of healthcare professionals. And after a while, you know, and it was a group. I should also mention it was a group for single healthcare professionals. Um, and so, because there were spaces for, all different types of groups, right? We were all looking for community. We were all looking for human connection. Is really what was happening during COVID. And the only way we could do it at that time was through these online communities, and that's how it came about. And then after a while, there were so many people that wanted me to be a matchmaker. And so this has started the story of how this all happened. And so I expanded and I grew White Coat Romance into a dating and community app. And I really broadened it to our larger healthcare community of healthcare professionals and students, because there was so many people that were like, we want to be part of this. And so it just really warms my heart, that something that was so tragic, such as COVID, and how it really affected so many people, that there was something wonderful and beautiful that grew out of this. And then from there, I expanded the ecosystem into another group called White Coat Mingle, and this one was specifically for in-person networking events, and it was for social and professional connections, and they were and it I expanded even more, because what happened over time was I had friends and colleagues that were like, well, um, can you create something for us? Like, we're not single. But we love the idea of community. We love the idea of being around people like that understand us, that get us, and that's how White Coat Mingle came to place. And so with White Coat Mingle events, it was open to everyone regardless of relationship status. And this is where the friendships happen. This is where the professional networking. We all know how important that is, right? So it's not just for romantic relationships. And certainly, we all know that even one connection, one conversation can really change the trajectory of your life, whether it's your personal life or your professional.
Thank you, Dr. Nguyen. And that's pretty much a community that you're trying to build, which is creating an impact to us as healthcare workers too. We know that there's a lot of single healthcare workers out there, and they work so much, long hours. Sometimes they could be on call too, especially the doctors working in acute hospital settings and wherever they're at, right? So you're a physician, you're an entrepreneur and community builder. What really inspired you to go beyond clinical practice and focus on helping healthcare professionals connect with one another?
Yeah, and I think that, I was kind of stuck in sort of like the day-to-day life and just feeling really robotic, if I was going to be completely honest, and just doing the work. And it was just so much focus on taking care of others. I was taking care of patients. Patients always come first, the family. And then I felt like well, I mean, I put myself in the back burner. It was something that I just felt like I needed to do, like to put others first. And I knew I wasn't alone. And so I think that when COVID happened, it really amplified, not that these weren't existing, epidemic situations that was already happening, but I think COVID really amplified the magnitude of what was existing, right? It was like that little, thread, on a loose thread in a clothing, and then it got unraveled, and all of a sudden now it's like this is something that we can't ignore. And so myself, when I was isolated during COVID, and I mentioned earlier, I was isolating myself from family and friends. It just it forced me to have a good look at myself and my life and where that was going. And so I think that's where that kind of grew out of it, and recognizing and also just admitting to myself, that I was lonely. I was feeling very isolated. we're humans. We crave connection. And so that was really important for me to acknowledge that and recognize that and to accept it. And then from there to say, what can we do about this? And also the beauty in all this was me also recognizing that I wasn't alone. And none of us are. None of us are alone. And so that's where this all of these communities that I started building with White Coat Romance and White Coat Mingle grew out of that, grew out of all that.
So, just to clarify, if you're single, then you can join the White Coat Romance, right?
Yes, yes. So I invite all of you, you're single, you're in healthcare, and I should also clarify, it's largely healthcare. We have physicians, we have dentists, we have nurses, RNs, we have nurse practitioners, we even have students are in the community. And then we also have a much smaller subset of non-healthcare professional friends that can join, but they can only join via invite code. Because it's really important for me to like have a space that was safe and that was a space where we felt like we could go to and not worry about like bots and scammers. So everyone is human verified, by the way. So, yeah, so it is a niche dating app, so I will say that. And it's really half dating. Half of it is like your typical swipe left and right. And then the other part is community interest groups where you can actually join. And it's pretty similar to like WhatsApp groups where you can join different groups and chat as a group and friend request. So you can join the app to like make new friends. The only criteria is that you have to be single to join White Coat Romance dating app. And it's free, by the way, and then you can download it on the App Store and Google Play. Um, and then as far as White Coat Mingle, that's really for everyone. Regardless of relationship status, it's basically the same community. And we do have, as I mentioned, we have some like non-professional friends that also come out to our events as well. So it's a really good opportunity to be able to engage across industries, like our attorneys, our MBAs, our entrepreneurs. And currently it's only been I've only been planning events in the local area in, SoCal where we live. I'm really hoping to expand it, but I do need some help. So if we have anyone who's motivated and interested in other major cities, I get asked a lot. They would like, can you plan something in like some other cities? And I would love to if I could get more support and
Thank you for that, and thank you for what you do. Now, I just would like to ask, and the audience may be interested to, what is the success rate for this? Are there any couples that you've seen get married, had kids, or had a perfect wedding or perfect ending?
Yeah, thank you for that question. That was really fun for me to answer that question. And so I say as this has been, I should say this is a passion project for me by and large, So I do have my daytime job, and so I do this. It's fun, and it gets, as with any entrepreneur endeavor, it gets really challenging. And what keeps me going are these success stories. So the Facebook group started in July of 2020. So it's been a good number of years now. And so we've had to date like 5 marriages. And then we have a couple in Texas. They each have 2 children, and they now have a baby boy. I mean, he's not really that young anymore. I think he's probably like 4 or maybe 5 now. It's been going on a number of years. And so I'm like his like unofficial like fairy godmother. So it really warms my heart when I hear these stories. And also there's just been countless relationships that don't end in marriage because not necessarily everyone is looking for that. But we've had a lot of um, you know, people who are still in like long-term relationships, like a number of years now. Some of my closest friends that they met through the group, and we just had someone get married, I think like 2 months ago. So it really warms my heart. It's really exciting for me. And beyond that, I think the bigger love, aside from like the romantic love and the marriages and stuff, is really the friendship. I would say is really the greatest love that comes out of these community is the bonds that you form, the meaningful connections, the friends that you make, that get you. And it's like, it's your people, it's your tribe, it's people that you feel like you can always turn to when you need anything. It's not simply connection, right? So in this day and age, we see a lot more of this online connection, right? So it's not the same. And so I just want to make, for me, it was really important that we have uh, meaningful connection, meaningful engagement. So, and the difference being that meaningful engagement would be like there's reciprocity, there's vulnerability, there's continuity, there's shared purpose. And it's not just likes and follows and endless scrolling, right? Because those are not meaningful. Like for me, I didn't want to create just another dating app. And most people are tired. I will be honest about that. I know the reality is most people are tired of dating apps. So I didn't want to create just another product. I wanted to create something that would help this community, that would connect this community in meaningful ways. And for me, like the mission is bigger. It's about combating, the issue of loneliness and isolation. So the platform that I wanted to build was just to move away from just these random um, likes and follows and being like deeply connected and having these conversations that matter, having these conversations that touch our soul, having these conversations that maybe can lead to like fun activities. Like we've had people connect and take trips together. And expand our horizons in terms of like what's out there, perhaps even provide each other like business opportunities that we didn't even know existed. And the difference is also about truly being visible, right? And not just another name or or title. So I think that was like for me that was like really, really important. That to have these meaningful connections in that aspect.
Yes, and it's part of the M's of mental health, like having movement, meaningful connections, mastery, and mindfulness, Mediterranean diet. All of those are component of our improvement of our mental health too. So our episode is called The Missing Vital Sign. Why do you think connection is so essential to our health and well-being?
Yeah, certainly. I think it's something that is like often overlooked. In that so many clinicians feel so deeply isolated despite being around surrounded by people, right? It's like part of our work. And we know that, you more than anyone knows that loneliness like predicts burnout, leads to depression, attrition. And it's like there's always have that always on work mentality, right? And so we just, I feel like the workplace especially isn't intentionally designed for connection. And so I think that aspect is is something that we have to really like critically look at. And like there's a lot of talk about workplace safety, right? People talk about that a lot. But I would say that connection is just as important as workplace safety. And it's something that we have to intentionally design for, right? And loneliness doesn't just like hurt our feelings, like I could talk about how the burnout and depression and also it can lead to like clinicians stepping away from medicine. And we see that happen a lot, right? Especially since COVID, right, amplified the situation. So we don't want that happening either. It's not that we don't want to be in medicine, practicing medicine, but when it continues to chip away at our soul, then obviously we know that this is a problem that we need to address. And it's really scary. Like I believe it's like almost like 50% of healthcare professionals are citing isolation and loneliness as a problem, that lacking social connection we know can increase premature death risk. And as much as smoking, I don't know if you heard the statistic, but as much as smoking up to like 15 cigarettes a day, which is why the Surgeon General is calling loneliness a public health epidemic. So it's quite staggering. And that when I first heard that, it was really like that reality like hit me even more of that statistic.
Those are great insights, and it's really important for us to create this connection because remember, the body, the mind, and the soul are interrelated. So, if we're not treating, if we're just treating one aspect of it, then we're not delivering the best care for our patients, and the needs, emotional needs, are not met. Now, healthcare professionals nowadays spend all day caring for people, yet a lot of them feel lonely. Why do you think that happens a lot?
Yeah, I think it's the disconnection. It's a lot about, I think, just taking care of others and not taking care of ourselves. It's that lack of self-care. It's really what it comes down to. And so, we hear the analogy a lot about the oxygen mask, right? About how, we're always told to like, to take care of ourselves first, right? Because if we aren't able to take care of ourselves, then we're not going to be able to take care of others around us. And that's something that is often forgotten. And so it's really about self-care. And that's something that I think a lot of us, the fact that we're even gravitated and going into, this, going into healthcare, right? It says a lot about who we are, right? But at the same time, I think that it lends to us focusing on helping others, about being there for others, and not so much about ourselves. And we forget that piece that's just so, so important. It's so, so critical for our health, our well-being, you know, if for ourselves, for our families, for our communities, and for the patients that we take care of. And so I think that that piece needs to be acknowledged and recognized, and something that we need to intentionally make sure that it is this vital sign, right? I see it as this missing vital sign, right? This connection in clinical life that we need to like really like acknowledge, and it's about time that I love it that there's more conversations about it, such as a platform like yours that you're doing, that we're talking about it more. But it's time to do more, right? And go beyond that, right? We keep on telling clinicians, right? Oh, to be more resilient, you just be more resilient, do this and that, but there's no tools. We have to like show you how. We have to give you the space and the opportunities, and not just adding on more to the workload, right? It's always adding more, but not giving us space and time to be able to like take care of ourselves. And it's like I see a lot of these like memos go around and talk about how it's on you to take care of yourself. But I don't think that's quite the right approach either, that we have to. I feel like leaders need to design the connection the way we design for like safety checklists, right? There's so much focus on that, but yet there's not enough focus on connections. Like a lot of times it'd be like, oh, we'll do like a 1 day, event, a yoga retreat, one event. It's not a one-time thing. It's something that we have to nourish and build, and to create a space for the clinician to feel that sense of connection, to give them the space to have the self-care, to be able to connect with one another.
Very well said, and thank you for your insights. Now, we also talk about burnout in healthcare, but not as much as about loneliness. Why do you think they are interrelated or connected with each other?
Yeah, that's a very good point, by the way. Like there is a lot of like burnout, burnout, burnout. But burnout is more, I see it more tied to like work, right? Um, and it's not about connection, you know? It's not about, because we're human beings and we need to be connected to ourselves and we need to be connected to others, right? And so the loneliness is a piece that requires that reciprocity that I talked about, right? It requires the continuity, the shared purpose, like the sharing of one another's experiences. Like we need to share with one another, right? We're humans, right? And so that's a key part of who we are. And and somehow along the way, we talk about burnout and it's normalized, but loneliness hasn't quite been normalized. Like as if it's made for the individual clinician to feel like it's a personal failure when it's not, you know? Um, and so I think that a lot of these dialogues and a lot of these conversations needs to change about how we approach things, and that it's really important that clinicians feel like that if you're feeling lonely, you're feeling isolated, there's nothing wrong with you, that it's your environment that needs to change. Something around you is missing, is how I feel. We need to like have that peer support, right? We need the protected time for team connection. Like these are pieces that I feel that is really important for organizations to have to help the healthcare professional be able to thrive, right? And if we thrive, then our patients thrive, right? These are the domino effects.
Correct. I agree with you. It's really a domino effect. If the clinicians are happy, they're able to function effectively, and the patient's outcomes are better. And happy clinicians equals happy patients, and vice versa.
Yeah, absolutely.
Now, as a lifestyle medicine physician, where does connection fit alongside things like nutrition, exercise, sleep, and stress management?
Yeah, great question. So, lifestyle medicine, I love lifestyle medicine, and I love it because it really goes down to like the basics, right? This day and age, I feel like there's so much focus on on, just like a pill for every ill, right? You're just throwing medications
Mhm.
at people, adding on medications. Like this doesn't work, you add on another one, and it leads to more side effects. And then you're now giving someone another medication to treat the side effects that was created by the additional, either the dose increase or the additional medications. And then there's more like testing and labs and so I love lifestyle medicine because it goes back to the basics, right? So lifestyle medicine is really the evidence-based approach to how, you know, not just to treat conditions, but really it's about prevention. It's about reversing some of the chronic conditions that may be there, going down to the basics. And so some of the pillars of lifestyle medicine, aside from like a whole foods diet, it's also like movement. Really, you say exercise, but I actually really prefer the term movement. Is really what you enjoy, like just move, right? Um, and that we're made to move. And so whatever you enjoy, whether it doesn't have to be like the gym or the treadmill, it could just be like dancing, right? The things that you enjoy. And then sleep is super, super critical, right? That's another one that's not often, focus on, but that's so important. And then reducing like exposure to toxic substances and stress. And a big pillar of that is the community and social connection. And again, that's the one that people tend to like think about last, right? They think about all the other parts first. And so I see social connection and community as non-optional, right? It's fundamental as movement, as sleep, as your diet, right? And it's often the one that's often neglected. um, and so it's really interesting. So they actually did a study where they were looking at exercise in two different groups. One, and they had the exact same protocol where you did the exact type of exercise for X amount of time and you did it alone. And they had another group that did it together. And the results were staggering. And based on our conversation, it's not shocking to learn that the group that did it together, the court did so much better in terms of like their results, in terms of like the benefits of the exercise because they did it together. So it's something about the community, the social connection. We're doing this together. We're helping one another out, right? Because we all have wonderful things to contribute to each other to share. And so that's the beauty of it. It's that community and social connection that more and more. That's why for me, this has become like just really important part of the work that I do now that goes beyond like my work as like a clinician.
And thank you for the things that you're doing. There's so much patients that are needing to hear this right now. That's not all about the medication or pills. There's nutrition aspect, exercise, sleep, stress management. Mastery is finding a job or hobby that you enjoy, and that's also part of our treatment plan for our patients to improve their overall well-being. Now, what are some signs that someone may be struggling with isolation, even if they seem successful or are functioning well on the surface?
Yeah, I think this is a very tricky one sometimes, that is not always obvious, right? So it's easy to like, we think a lot about vital signs, there's the numbers, but when it comes to someone who's feeling isolated and withdrawn, I think it can come across in a number of different ways, right? The quality of the work may go down, right? Um, how they interact with their peers, how they interact with patients, right? They may come across as like you're a bad, doctor, you're a bad nurse, you're not making your job a priority. But there's so many more layers to it, right? Um, you can see it in sometimes their appearance, right? And it's not always their appearance, right? Sometimes like because they're not taking care of themselves, right? So there's that aspect of it of not providing that self care. But self care can come in many shapes or forms, right? And um, and also just there's that lack of hope I see a lot, you know, that lack of like that negativity, that hope, that lack of optimism, you know, that lack of interest that I see. And so I think there are lots of little pieces that we can pick up unless we actively, pay attention to one another and take care of each other. That's often overlooked. And I'm sure you
Yes.
could share a lot more during the great work that you do that you have noticed, and I would love to hear more about it too.
Yeah, like a lot of our providers could be withdrawing or either they're overworking and just showing up to work like feeling that they're full, but they're actually their energy level is at its lowest and they're kind of like struggling in the inside, but show outside doesn't match with their energy. So it's very important to provide the support for them. Now, what can healthcare leaders like you do to create workplaces where people feel supported, valued, and connected?
Yeah, and so I think, I love it. Like for example, like communities and platforms like what you're doing now, like Pedro, is to be able to have these conversations. And I'm glad that more and more we're having more of these conversations about loneliness. We're having more conversations about mental health. That we're acknowledging it, like it's not a personal failure. That you are enough. You are worth it, and there's nothing wrong with you. You're not broken, right? So I think having that as a starting point to normalize that, I think that it's so important. And then from there just to have like I think it's important that we have spaces and communities like whether it's my community through and I invite all of you to come join us, by the way. If you if
Mm.
you don't feel like you have a tribe, or if you want more tribes, please do come join us. I'd love to invite you and bring us in part of our community. So yeah, have have these be a part of these communities. And I think that it's also sometimes is important that we need to reach out to one another, right? And I think one of the biggest issues we have is asking for help. I think that's a problem a lot of us have, and I will admit that I myself have that issue as well. That it's hard, it's not easy, and I recognize, and sometimes I have to like remind myself, like it's okay to ask for help, So yeah, don't be afraid to ask for help. Reach out and invite someone to something, or ask how someone's doing, how their day is doing, and they may not always want to tell you, but I think over time, I think it's all part of like building the relationship, right? And building
Mm.
that trust, building that comfort level with one another, and just being truly authentic and genuine about these connections. And I think that it goes a long way to help one another out there. So yeah, so that's I think those are some of the things that come to mind right now. I'm sure there's a lot more that you could probably share with us as well, but that's what comes to mind to me right now.
Yeah, and a lot of healthcare providers out there, they're always giving care, but according to survey, we are the last one to seek help when we need
Right.
to, right? So we feel like we're saving all our patients, but who saves us when we need it the most? So that's where in it's really important to recognize that it is okay not to be okay, and it's just a matter of having a platform to talk about it. That healthcare providers too are vulnerable about their mental health.
Yeah, I love that. Thank you for saying all that.
Yeah. If you could change one thing about healthcare culture right now to better support mental health and connection, what will it be aside from your platform?
Yeah, for sure. I say normalize the talk about loneliness and and isolation, and not make it feel like there's something wrong with the clinician, right? And so for me, my hope is that we will treat connection and community as an essential infrastructure of our healthcare system, right? Um, and that make it an important piece, just as important as all the other like so-called vital signs, right? And I think it's also important that we, we things happen, on a much greater scale, and we have more fun in the process if we partner with one another, right? Whether on a local level or on a larger scale, partner with different communities like such as yours, like nurse platforms and some of the other clinician communities out there. So I love like partnering, and that's what I do at a lot of my events for White Coat Mingle. Is that I try and partner with a different community, and it's a good way to like mix it up. And so I think that that piece is really important, that we can, one, be more honest about loneliness and the mental health um, crisis and the pandemic that we're having with loneliness, and to be able to uh, invite others in and encourage self-care, encourage social connections and communities, and create spaces and also opportunities for that to happen, and not just leave it on a single individual who may not be at a place in their life where they are able to reach out, right? So we got to be able to make them feel welcome and bring them into our tribes.
I agree with you, Dr. Nguyen. I think change needs to be implemented and at the same time, openness, right? Create a seat for a conversation. And that's something that we need to implement. Now, there will be audience out here that are healthcare workers or very interested with white coat romance and white coat mingle, but they are concerned about their safety and privacy. Like, what is your actual process once they join in this community? And if I
Yeah,
feel like is my information safe, or I feel like, oh my god, I may have some emotional safety issues, how will you clear that and clarify that for those who are really interested to join it?
yeah, certainly, absolutely. That's a really good question. And so that was something that was really important for me, that number one was safety. Safety was the priority for the app for me, right? So I made sure that we designed that. And so, as I mentioned earlier, like everyone is human verified. And so I make sure that, I mean, the likelihood of a bot and scammer is like next to zero unless like someone has found a way to get around it, because I verify everybody for the time being. So I can guarantee you that. I can guarantee you that there are quality people. There are real people, right? Not on like your, not on your like mainstream dating apps where there's like a lot of like fake, and bots and scammers. So I can guarantee you that. So I want you to feel safe about that. And just an aside story, like being on dating apps, and I myself have struggled with the whole thing with like, oh, what should I put as my title, right? Should I say I'm a doctor? Should I say I'm in healthcare and medicine? And then would I, if I say something, would I be like a target for scammers, right? And so there was a lot of that concern and that worries. And so I can promise you on White Coat Romance that everyone's title and degree is out front and center. We celebrate your accomplishments. We celebrate the amazing work that you do. We celebrate that all you give to our community. We celebrate all that you give to your patients. And so you don't have to worry about that, right? And that we have like safety features within the app to make sure. And in fact, I actually had a conversation with somebody where I'm going to add on another additional safety feature layer. So that's in the works. So I'm really excited about that. But I'm always open to suggestions and ideas, and because I want to build this for our community. And so and it wouldn't, for me, like at the end of the day, like give me the feedback. Let me know. Like I want to make this even better and better for you. I want to find ways on how to connect everyone better, right? And so I love love. So it's that's what really keeps me going. It's like I said earlier, it's a lot of work, and I will be honest, there's been so many days when I thought about like just shutting this all down, you know? But I think when I hear these stories about, whether it's the marriages, whether it's a long-term relationship, whether people just simply connecting, finally going on their first date, finally like making time for themselves, or just being friends and say, hey, I'm looking for a travel buddy, these are things that really warm my heart, and that's what keeps me going. And so for me, like, I want to make sure that this is the safe place for you, that you come in without any reservation, without any worry about your safety, and that you know that this is your tribe, that you can just be you. These are people that will speak your language, that understand your lifestyle. I mean, sure, there's, obviously we have different types of healthcare professionals, and I think that's also part of the beauty of it is to be able to like learn and grow from one another.
Thank you for emphasizing the emotional safety that is included on the feature of the app, and I think that's very important. And at the same time, we're working longer hours. Sometimes we're so drained, so we really need to go to a place that we feel relaxed and somebody to talk to. Now, finally, what message would you like every healthcare professionals listening today to take away about connection, mental health, and well-being?
Yeah, so thank you for that question. And this is such an amazing conversation. I really want you to know um, that you are enough. You're exactly where you should be, right? And that's something that I say this to you because I'm also saying that to myself, right? Because of all the years of education, like what it takes to like to get to our degrees, right? It's a lot of sacrifices, right? And some of us may feel like we've missed the boat, but I say that you are exactly where you need to be. And so there's beauty. Just have faith and have hope in the beauty of the design, and that this is your journey, and embrace the journey, and that we are here for you, and your tribe is here for you, and that if you're listening, and if any part of what I'm saying is resonating with you, I want you to like stop putting yourself in the back burner. I want you to focus on you. It's your time to shine, and that that make yourself a priority, and that by doing so, that you will be this much even more amazing version of yourself, in your personal life, and as well as your professional life, and the people around you will see the difference and feel the difference, right? It's these domino effects, right? When we make that one little change, and that it may not always be obvious, but I can promise you that it's happening. So if I can give you like one little like exercise to do this week, I want you to reach out to like, whether it's an old friend or a random stranger, a new person, and make that connection. Have the truly meaningful conversation, even if it's like online. Not just a like, but truly have a meaningful engagement. And so, and also feel, I invite you to join, whether it's my communities, but any community that you feel aligned to. And I think that's the part that's really important, right? Be a part of something that aligns with your heart and your soul.
Thank you, Dr. Nguyen, and thank you for joining us and sharing your insights, your experiences, and your vision for a more connected healthcare community. Today's conversation reminds us that mental wellness isn't only about reducing stress or preventing burnout. It's about belonging. It's about having people who see us beyond our credentials, support us through challenges, celebrate our success, and remind us that we're also human first. And to all our listeners, if today's episode resonated with you, consider reaching out to someone today. It can be your colleague, your friend, your mentor, or a loved one. Sometimes a simple conversation can make us a profound difference. Thank you for joining us today, Dr. Chrystene Nguyen. And where can they follow you, or where can they sign up if they want to start this White Coat Romance and White Coat Mingle?
Yeah, please. Connect with me. I'm because of the work I'm doing, I say everywhere, but that's an exaggeration. But yeah, you can easily find me on all the socials, all the big ones, like on Facebook, on Instagram, on LinkedIn. I'm on TikTok. Yeah, it's a small part of the time. And then as far as White Coat Romance, we also have our own social channels as well. It's same thing with White Coat Mingle. So you can find us on Instagram, Facebook, as well as LinkedIn for all that. We also have a website, whitecoatromance.com. But if you're ready to dive in and join the community, I say let's do it. You can just go to the App Store and Google Play and just type in White Coat Romance app, and go ahead and come join us. It's free, and I would love to see you there. And feel free to reach out to me, and I'm happy to make connections if you guys would like some help, if you're a little shy. And then also, if you follow the socials, and I'll announce like events that I have. I actually have a White Coat Mingle event in SoCal area in about 2 weeks. So if you can't make it this time, and they vary in terms of size depending on who I'm collaborating with, but I really hope that you can come join us. And I would love to meet you in person and have some meaningful conversations with you all.
Thank you for joining us today, Dr. Chrystene Nguyen. Once again, to all our followers, listeners of this podcast, please check on White Coat Romance app and White Coat Mingle app. It's a great way to connect with your peers, colleagues, and create a meaningful engagement. Until next time, take care of your mind, take care of your relationship, and take care of one another. We'll see you on the next episode. Thank you, Dr. Nguyen. Woohoo!
Again, Pedro, it's been amazing. Thank you so much. Appreciate you.
Thank you.
Thanks for listening to Mindful Moments with Pedro Morante. Be sure to follow the podcast so you'll never miss an episode. If you find value in our time together, leave a quick review. It helps more people discover the space we're creating. For updates and more reflections, follow us on social media. Until next time, take care.